I would now like to invite Victoria Charette, Dan Lattiser, and Stephanie Parks to present their class reflections.
Hello, everyone. Thank you, family and friends, for being here tonight, for being great support to all of us. Congratulations, class. We finally made it through the flagship. And congratulations, family and friends, for today is the last day you will hear us complain about the stress of nursing school. Together, we have been through this incredible journey. I would like to take you back to the beginning to reflect on these past 2 years. It was exciting and nerve-wracking getting our application in, wondering if we would be accepted and what change it would bring to our already hectic lives. But I have to say that feeling that we got then did not stop. When we opened our acceptance letter, we already felt a taste of success. All of our work leading up to this moment was in that acceptance letter. Then we read a few lines down and realized that we had to take a math test that needed to be a perfect score before even starting class. We get to the bookstore and proudly say, "I am a weekend nursing student here to pick up my books and scrub uniform." As they scanned in each book, our skin became diaphoretic and our hearts sank as the price kept on increasing. We left with a suitcase full of books. And I have to say, I am definitely guilty of going home, trying on my scrubs, taking a picture of it, and sending it to my mom. So we get to our class and are told that we will become a family. As we looked around the room, I don't think anyone really understood what we were going to mean to each other. Thanks to Marlene, our motto has always been, when you help someone up a hill, you get that much closer to the top yourself. That has been true many times through the past 2 years as we used each other to vent to, a shoulder to cry on, a house to study at, or someone to share a bowl of ice cream with as we studied. Our first semester was about building our foundation and learning the basics of nursing. For example, we learned how to properly take blood pressures, and Krista was able to teach us that blood pressure cuffs can be used if you are locked out of your car.
And the key's right underneath that.
Still, we were all very nervous about critical elements and feeling palpitations before even knowing what they were. As Julie Soul said, because the rest of your life depends on it. We started our second semester feeling as though we might actually have a good understanding. Then reality kicked in. Our first clinical day that we had to prepare for the dreaded pre-conference, we compared the amount of sleep we got the night before. Someone said they hadn't slept at all. We took half of our clinical days passing meds and getting bed baths done, wondering how we would ever be able to manage our time. As the semester went on, we faced some challenges along the way. The content of the course became more difficult, but we were growing closer as a family. And just as we were getting the hang of med-surg, we were done and on to maternity.
We entered maternity excited to learn about new lives being brought into the world. We'll never forget how to teach people to relax when they're giving birth, and we'll never forget to massage their fundus after they deliver. Our class got to see Jess as a pregnant Haitian patient before she was truly pregnant, and I don't think we ever decided what we were going to name it. Was it tularemia or strateria? You don't want to know what those mean. And I had a chance to humor everyone in lab when I popped off the baby's head. It was a mannequin, I promise, but yeah. As maternity ended, so did our first year of nursing school. We were halfway there. We were sitting at Maggie's, eating lunch, waiting for our final exam grades to be posted. We were really nervous. And the song Living on a Prayer came on. It was perfect moment. We were definitely living on a prayer, and we were halfway there. Then we had another med calc test that we had to get 100 on, but this time we got to use our calculators. But that didn't help some of us. They still figured out we were going to get 400 sublingual tablets. Don't know how we're going to do that. We all knew that third semester was the hardest. I don't think any of us went in thinking it would be easy. Some of us changed from working full-time to part-time, and other of us stopped working completely to manage the tasks of life, along with the difficulties of third semester. We went to Open Lab often to work on memorizing insulin's peak time of action, perfect each possible IV push medication we might have been asked to give, and practice administering blood. And nothing could have been funnier than the time that Tori's husband, Nick, got to Fort Drum Gate and they checked his vehicle and found the blood. He had to say, "My wife's in nursing school. I don't think it's real. It's pretty sure it's fake." In third semester, we don't only manage med-surg, but we also tackle pharmacology as well, learning each and every kind of medication, how it works, what the side effects may be, and sometimes how you have to reduce the medication, or are an instructor's words, seduce the medication. Don't worry, we corrected her. We wrote our case studies, which we were all glad were over, only to find out we had more to do in fourth semester. And none of us can forget the time that Tori confidently raised her hand answering hypoglycemia, only to be shot down. It wasn't hypoglycemia. Third semester was split in half, so the second half we had the pleasure of taking psych nursing. We spent many long 12-and-a-half-hour days on the psych unit, where sometimes we thought maybe we should be. We learned effective communication with people that were getting more better, and some were getting worser. We also learned, don't worry, that's not a real word. We also learned that instead of calling people diabetic or high cholesterol, we were now just going to refer to them as glucose hoarders or lipid slugs. Just kidding, just kidding. Our long days seemed to get longer, but the end was coming near.
All right, so here we are, fourth semester. Fourth and the final semester began, and it seemed as though our goal was near, but yet so far away, as it was only June. We began to feel more confident and competent as we had all moved on from the hardest semester, third semester, and we also had to pass another final med calc examination with 100%. As many of us thought this would be easier than the rest, we can finally relax, and we will be done and over before you know it. Boy, were we wrong. This semester brought about new critical element tests, 6 exams, 14 clinicals, and multiple lab and classroom hours, which were improved by Sunday morning donuts and coffee. We still missed family events such as weddings, parties, and vacations, devoting our time to the nursing program. We all lost countless hours of sleep studying and preparing for our patient assignments for clinical, but in the end, it was all worth it. We were fortunate enough to have 3 pediatric clinicals at Golisano Children's Hospital in Syracuse, which was absolutely amazing. We all met at school, 5 a.m., and would talk to each other out our car windows. Julie Roy would drive over, we all loaded up, and we were off in our big white van to Syracuse. I offered to drive, but she wouldn't let me. She just smiled and said no, and I don't know why this is. Maybe it was because the windshield wipers didn't work. I'm not really sure. I'm sure she heard some great stories she never wanted to know about us along the way. We all learned that she has a difficult time distinguishing left from right at 5 a.m., as we told her to turn right and then had to inform her she needed to go the other right. But it was all within good fun. We were all reminded to bring our licenses in order to be allowed into upstate. For some reason, Kelly forgot hers. So we all would like to thank Kelly's wonderful husband, John, for meeting us at 5 a.m. at a gas station. We were not only introduced to a new clinical setting and a higher acuity of patients, but this is where we all met Mr. Apple. For those of you who do not know, Mr. Apple is a half mannequin whom we performed our critical elements, trach suctioning and trach care on. Let's just say he made us more nervous than our actual patients did. A lot of changes also took place this semester. We unfortunately lost some instructors due to retirement and new career choices, but we were thankful for their knowledge and experiences that they instilled upon us. We acquired a new beautiful nursing laboratory with more practice room and high-tech state-of-the-art equipment. We also gained our new nursing department chair, Dr. Marie Hess.
Although our 2 years are finally over, there are some things that the 8 of us will never forget. Gen A, Podunk General, Snapchat Wars, Sista Krista, and Hot Potato Baby. Inside jokes, sorry guys. As Tori said, during the first few weeks of classes, Julie's soul told us we would become a family, and I can remember all of us looking at each other in disbelief. Well, we did become a family. We have lost some of our closest friends along the way, but they will always remain part of our family, the weekend class of 2016. At this time, I'd like to say thank you to Kat, Kelly, and Emily for making the slideshow you're about to see.